to our health. You know, sometimes we need to ask for help, but our best efforts sometimes just aren't enough. And now our state is reaching out, looking for a new way to tackle health care.
The state board in charge of the Health Benefit Exchange is going to adopt a different approach, opting for the technology that they're already using in Connecticut.
All right, let's go live right now to Annapolis. ABC2's Christian Schaefer has been tracking the breaking developments for us tonight. He's there live.
Yeah, busy day, guys. You know, the first open enrollment period under the Affordable Care Act, also known as Obamacare, ended yesterday. One day later, today, Maryland has decided to scrap its health exchange system and adopt the system that Connecticut used for its open enrollment.
After more than 2 years and $200 million, the state has decided its health exchange website simply cannot be fixed.
It lacks the functionality to meet the requirements of the ACA. It did in October, and it continues to struggle today.
The Health Exchange Board considered 3 options. Try to fix the current system, but that would have cost another $66 million, taken 12 months, and still may not have been successful. They could have used the federal government's system, but the state would have still needed to build its own separate system for people signing up for Medicaid. The third option, adopt another state's system. Connecticut's health exchange worked well.
We are recommending that Maryland leverage the IT platform and code base from Connecticut to upgrade the health connection.
So this fall, Maryland's health exchange will look like, and it is supposed to work just like Connecticut's.
By unanimous vote, the resolution is adopted. Thank you very much.
At a late evening news conference, Governor O'Malley pointed out that nearly 300,000 Marylanders did sign up for health care during open enrollment, but only 63,000 of them will be paying for insurance. The rest signed on through Medicaid. Paying customers are a key to funding the Obamacare proposals.
Part of being a leader also involves taking on the risk and the vulnerability that you might not succeed.
And now that there has been an enrollment period, he says the state can learn from what worked in Connecticut.
We would like to be sitting here and saying, wow, Kentucky and Connecticut saw that Maryland worked well, but our contractors let us down on that score and did not deliver that which they promised. And then when they said they could fix it, we're incapable of fixing it.
Yeah, as for the contractors, the governor singled out the subcontractor IBM at the news conference tonight, saying, quote, "We'll see IBM in court." So while it appears the state has chosen a path forward, it's still clear that there's going to be a lot of recriminations as far as what happened to this year's website. Now live in Annapolis, Christian Schaefer, ABC2 News.
All right, Lieutenant Governor Anthony Brown has been in charge of the health care program in our state, and he's also running for governor. One of the Democratic opponents, current Attorney General Doug Gansler, released this statement about today's decision, and it reads in part, "Maryland is more than 130,000 enrollees short of Brown's own goal, yet he's called it a success. If this is his definition of success, I don't want to know what failure looks like."
And Republican candidate Larry Hogan also released a statement saying it would be better to shut down the Maryland Exchange altogether, and pointing out that, quote, paying tens of millions of dollars for another state's platform won't cure the hopeless mismanagement by Anthony Brown and the leadership of the Maryland Health Benefit Exchange. As you'd imagine, some strong reactions there. We want to know what you think. Is this the right direction for health care in Maryland? Leave us your thoughts on our Facebook page at abc2news.com/Facebook.
All right.